As hospitals and health systems become more data-driven, how can they leverage the power of the cloud to improve outcomes?
I think analytics are a team sport. If you're focused on operational leaders requesting reports from the IT team, and the IT team's just delivering the reports, I don't think you're going to be as successful as you want to be. So the first thing you want to do is make sure that you have great data governance. The data has to be clean. It's got to be high quality. You have to have common metrics, well-defined metrics, agreed upon metrics, and that takes teamwork, partnership with between IT and operational leaders, clinical leaders, and you actually really have to be on the same page with how you're delivering the data. So that data governance, the partnership, that team sport concept of analytics is really important.
I think one of the key things to remember is to take advantage of the single patient record, where you've got an EHR that covers both your outpatient, inpatient, and ambulatory settings. That really gives you a lot of power to look at clinical, financial, and operational insights across your organization.
One important thing to pay attention to is data governance. And data governance is all of the processes, procedures, definitions, security, access privileges, management of the data, understanding what information you have in-house, what's that single source of truth, where does it reside, is it well defined, is it 100% complete, 100% reliable, 100% accurate? Because without knowing what your data resources are and having them well defined and well governed, you can't proceed with any further data analytics.
I think that the second part of analytics is that true good business clinical intelligence analytics is a journey. And that journey takes potentially multiple years depending upon your maturation. If you think about the analytics journey, it really starts with descriptive analytics. Descriptive analytics means using your data, your electronic health record, your data warehouse to describe what happened last week, last month, last year, and really tell the story to the business of where you've come from, what actually happened in the past. As you start to mature that, then you can start moving into more predictive analytics, where you're focusing on what's going to happen tomorrow, what's going to happen next week, what's going to happen next month. So you're using that foundation of descriptive analytics, but then you're starting to turn it into predictive analytics. The next phase of that journey is really prescriptive analytics. That's not only telling you what happened yesterday, what's going to happen tomorrow, but what actions can you take today to impact your destiny? What actions can you take to actually what's going to impact tomorrow? So that's when you really know that you're maturing your intelligence platform, your analytics capabilities, and that you're really using your data to change how you're delivering care. I think our greatest opportunity and frankly, our greatest challenge is just the vast amount of data that we do have. We almost have too much data at this point. It's really hard for busy clinicians to really sift through all that data and figure out what the story is. So our greatest opportunity and our greatest challenge is really to actually take all that data and create actionable insights and intelligence to make the jobs of our nurses, our doctors, and frankly, even our patients better and easier so that they actually have the information they need when they need it. So for example, we have a diabetes RPM program where we actually are bringing the data from the patients, the diabetics, from home into our electronic health record and our intelligence tools, allowing technicians to be the line of first defense. So it's technicians who are able to see the data, be healthcare coaches to those patients, relieving the nurses and the doctors to do those things that they're really needed to do.
The greatest opportunities I see are in collaboration and expanding your data reach beyond your own four walls. As a healthcare provider, the electronic medical record that you have represents the individuals you see when they're in your care. Looking beyond your four walls, you can collect data from other healthcare providers, community providers, population data, etc. And that will help you get a full longitudinal 360-degree look at the people that you serve and help you understand where they've been and where they go after you see them.
I think one of the biggest challenges is to identify what you're looking for in that data, because if you start looking at fancy graphs and dashboards, it can be very intriguing, but I think it's really important to identify upfront what your objectives are for the organization, whether it be a clinical outcome, a particular financial outcome, and to identify those so that you can start focusing on one of those questions that you're asking at your organization.
Data focus is very important. What I mean by that is you need to focus on a hypothesis or a use or business case for the data analysis you're going to do. Otherwise, you can be overwhelmed by the amount of information you're looking at and not know where to start. So have your hypothesis first, then determine what data resources you need to prove that hypothesis or meet that business case. Determine whether or not that information is in-house or whether it needs to be acquired externally. Is it well governed? Is it reliable? And once you have that hypothesis or business case and you've proven it out and you've determined the feasibility, you can move ahead assured that you have a well-defined data project ahead of you.
First question I would ask is, my data secure in the cloud? When you're talking about your on-premise data versus cloud data, you really have to think about all the power that a cloud IT vendor puts into cybersecurity and the investments that they make into protecting secure health information. And so absolutely, yes, your data is much more secure in the cloud than it could be on-premise. And we see that every day as we are literally monitoring cyber attacks across the globe. We see that. Second question is, are you going to keep my IT shop up and running effectively? And if you think about the cloud, you can do that much more effectively. You can scale environments instantaneously. You can make them geo-redundant, meaning you can have data centers in multiple locations, and you can make the system highly available across multiple regions. And so if you were in a traditional data center and you had power cut to the data center or some natural disaster, you would not be able to access your healthcare IT data where you could in the cloud because it's geo-redundant.
Think about the possibilities of collaboration and whether or not you would be able to collaborate on a large scale using an on-premises solution. Cost out how much it is actually costing you for your on-prem solution, including all of those hidden unallocated costs of overhead, staff, etc., and then compare to the price of a cloud solution.
As healthcare systems look at their cloud strategy, their IT architecture, they really need to look at what their key vendor strategic partners are doing. What you don't want to do is be on a different platform, a different architecture than your key strategic partners. You want to actually be able to go with them to the cloud, make sure you're staying on the leading, bleeding edge with them, and taking advantage of the latest and greatest functionality.